Right, good morning, Queensland. Well, in some very good news overnight, we have had 0 new cases. So congratulations, everyone. But of course, we're monitoring this situation very closely over the next 2 days, especially as the Greater Brisbane region is now in this lockdown. So we have 21 active cases. And can I thank Queenslanders who've come out in droves to be tested? We have had over 14,784 tests in the past 24 hours. Can I just remind everyone that in that Greater Brisbane area, we have 178 clinics that are currently open. So if you have any symptoms whatsoever, please go and get tested. Now, of course, we are doing this because of the highly infectious UK strain. Can I thank everyone who has been wearing a mask? On my way in here this morning, I passed several people who were walking their dogs or cycling, and they all had their masks on. So thank you very much, everyone, for doing the right thing. We've got to keep it up for the next couple of days. Now, Dr Young's going to also update everyone on another issue, and we've just been advised from Melbourne authorities that a woman has flown into Queensland. She has flown in on a Jetstar flight. We are still awaiting to get those details, and she's also positive to this UK strain. So Dr Young will go into more details about that. Finally, can I also just say to Queenslanders, can you please, especially in the Greater Brisbane region, please be respectful to supermarket staff as well. But we are seeing general compliance across the Greater Brisbane region. I know it's tough on people to stay at home for a long weekend, but we're doing this and everyone's acting very responsibly, and if we stay strong and stay calm, we will all get through this together. So I'm going to hand over to Dr Young now to go into a bit more detail about this latest information we've just received from the Victorian authorities. But once again, that 0 new cases overnight is welcome news. But once again, if you have any symptoms, please go and get tested today. It's very important that we try to contain this virus as much as we can, especially in our Greater Brisbane region. I'll hand over to Dr Young.
So no new cases in Queensland overnight, but late yesterday we were notified that a case that had been confirmed in Victoria had moved up to Queensland, and the genome sequence result had come back and she was positive for the UK variant. So she arrived into Victoria on the 26th of December, flying in from the UK. She got tested in hotel quarantine there on the 27th of December, and she was found to be positive. So she was then isolated and did the 10 days required isolation, cleared all her symptoms, and was allowed to leave Victoria and fly to Queensland on the 5th of January. So she flew on a Jetstar flight, arriving here in Brisbane late on the 5th of January. We're just confirming the details of which flight, because there were a number of Jetstar flights that evening, so we're confirming that at the moment with her. Then she travelled up to Maleny, where her parents live, and she's been staying with her parents. So her parents have been tested, and we're working through any close contacts that need to be looked at there. So she lives in a house with her parents in the outskirts there of Maleny. Now, we got her tested here yesterday and she's still testing positive. So that's why we're now following through with her contacts. The risk is extremely low, very, very, very low, because she is right at the end of her potential infectious period. And with a normal variant, we would not be at all concerned. 10 days is more than sufficient, and she's now up to day 15. So it would not be a concern. But because of this new variant, we're just being ultra cautious. which is why we retested her when Victoria let us know that she had the new variant, and we found that she's still excreting virus, so we're just working that through at the moment, and we will be contact tracing those people on the flight where she sat, the 2 rows in front behind either side, so we'll be doing that, and we'll be putting out messaging about for other people on that flight to be aware and get tested if they develop any symptoms, and anyone who lives in that Maleny and that immediate area around Maleny, if they develop any symptoms, could they please come forward immediately and get tested. So as I stress, this is very, very, very low risk, but it is not zero risk, so we're just taking all of those precautions. Now, in terms of our lady who cleaned at the Grand Chancellor and is a confirmed case, I do want to remind people of the locations that she had been to, and if anyone who's been to any of those locations and has not yet come forward and got tested, could you please come forward? We've now tracked 91 close contacts of this woman. All of those have been tested, they're all negative, and they're all now in 14 days quarantine, and we will retest them if any develop symptoms or at an exit test day 12. So all of the close contacts, we're confident that we've contacted those 91 and that they're in quarantine, but I'm concerned about the casual contacts. So those are people that we can't exactly find out who they are, so I need the message out there. So I'm going to repeat it again. So those are people who travelled from our Tandy station to Roma Street on Saturday 2nd of January at 7 a.m, who travelled on the train from Central Station back to our Tandy station on Saturday 2nd of January at 4 p.m. People who attended the Woolworths Callumvale North store on Sunday 3rd of January from 11 a.m. to 12 noon. People who attended the Coles Sunnybank Hills store Tuesday 5th of January from 7:30 a.m. to 8 a.m. and people who attended the Nextra newsagent at Sunnybank Hills Shopping Town on Tuesday 5th of January from 8 to 8:30 a.m. So that is important. All of those people, whether or not you have symptoms, I would like you to come forward and get tested no matter where you are. If you're elsewhere in Queensland, wherever you are, come forward and get tested. Then anyone else who's developed any symptoms here in those 5 local government areas of Brisbane, so I'll just remind people of those: Moreton Bay Regional Council, Brisbane City, Redland City, Logan City and Ipswich City. Anyone in those 5 local government areas, any symptom at all, it is really, really important you come forward immediately, and the usual message continues to apply across the whole state that I really and truly would like anyone with symptoms to come forward and get tested. In this cluster, so far only 1 person in the cluster, with the gentleman who gave it to her, of course. We've found the first person, which is so critical. That's what I want to do every time, find the first person so we can immediately get everyone into quarantine, as we've done with those 91 contacts so far. Thank you.
Are you happy with those testing numbers that we've seen overnight?
Yes, they're excellent. Yep. So the last few days we have seen a fantastic response from Queenslanders coming forward and getting tested. We have stood up a large number of additional clinics, as has the private sector and the Commonwealth with their respiratory clinics, so we have plenty of capacity. So please come forward. You probably won't have to wait for very long and you won't have to wait for a result, so that's so important. Come forward and get tested. And the other thing, similar to the Premier, as I drove in this morning, every single person I saw was wearing a mask, which is fantastic. For the next 3 days, this is really important that everyone throughout those 5 LGAs wears a mask.
We've heard a lot about how it's more contagious. A lot of people at home they're thinking, oh, well, there's no new cases today, we're through the worst of it already. What's your message to people?
We're too early. The important thing is for us to get those close contacts into quarantine, so should any of them become positive, because remember the incubation period is 14 days, they're already in quarantine, so they haven't been out and about in the community during their infectious period. Remember, it's the time spent while infectious out in the community that is the risk. So our first case, the lady who did the cleaning at Grand Chancellor was out and about in the community for 5 days while infectious. We want all of her close contacts to be in quarantine, and that's what this 3 days is going to give us a chance to do.
Dr. Young, what would spark a longer lockdown period than just this 3 days? What would make you extend it further than 3 days?
A lot of cases. So we just need to wait and see. We've got to take this. I know it's frustrating for people, and I do apologise about that, but we've just got to take this day by day and see what happens.
Is a longer lockdown period a possibility?
Anything's a possibility, but I'm not going to say how likely any scenario is. This virus, we really don't, even the usual variants, fully understand it. We're seeing that at the moment down in Sydney with some very lengthy periods and then another case pop up. So we just have to take each day and get the best information we can. And the best information is when people are out there getting tested. The more people who get tested, the more reassured we can be that we don't have chains of transmission. So it is really, really important. Any symptoms, please come forward and get tested.
Dr. Young, would this be kind of the new standard? You know, one new case, we go into lockdown?
No, this is because of this new variant and because it's the first time this new variant has been out in a community anywhere in the country. So that's why we've done this. This is the first. So if you remember back in March, we did a lot of firsts then and we learnt as we went through and we modified procedures. This is the first time now. So we'll learn and we'll work out what we'll do next time if it happens.
Just to clarify, that woman who flew in to Queensland from Victoria, was she infectious on that Jetstar flight with UK Australia?
I don't know. She would have been very, very at the end of her infectious period, but she did test positive yesterday.
Did she test? So she tested negative though before she hopped on that flight. The Victorian officials thought she was negative at that time.
No, they followed the previous protocol, which is that you didn't need exit testing, because if you remember, a lot of people continue to excrete virus up to 120 days after their illness is complete. So we removed the requirement for exit testing quite some time ago. People needed to have had no symptoms for a minimum of 3 days, which certainly was the case, or at least 10 days from when they were tested, and it's whichever is the longest. So you've got to have had first no symptoms for 3 days, and then second, it's at least 10 days since you tested. So she met those two criteria, so therefore she was allowed to leave isolation.
In light of this, do you think exit testing should come back?
Well, we've brought it back for this
Oh,
variant.
yeah.
Yes, so it's in place now.
All right, now we move on to the Health Minister. Thanks, Dr. Young. And then our Deputy Commissioner.
Thank you. So just in relation to the woman who has travelled from Victoria, we're very pleased that there is a very low risk in relation to this individual, but we still will be directly contacting those who sat immediately around this individual on the Jetstar flight on the 5th of January. We understand there's 3 Jetstar flights that came into Brisbane on that day. We're just getting the flight details now so that we can make that direct contact and, of course, put the general information about anyone on that flight. What is important is the scenario that we have now seen from this woman, which is leaving on day 10, not having an exit test, and, importantly, not having the genome sequencing known until after she was released, would not be occurring now. So in Queensland, every person who tests positive in Queensland for COVID, their genome sequencing is done at the same time, and the results would be known before they are released to know whether they have the UK variant or any other variant for that matter, including South African variant. So we would know that before they're released, and also we would be doing an exit testing on anyone who has this other variant. So we're pleased that the processes that are now in place, and I understand this has been agreed to nationally now as well, we would not see anyone with the UK variant being released before we have that information and they're getting those exit tests. So we thank this woman for her cooperation overnight. I'm sure it's not easy to have gone through full quarantine plus isolation only to finally get to come home to her family and be tested again and find out that she's still positive. But we will be taking the advice of the Chief Health Officer as to whether we need to do any more contact tracing beyond that based on the results other than the immediate family. But of course we are asking people in the Maleny and surrounding area, if you do have any symptoms, to get tested. In relation to the lockdown, can I say thank you to everyone who has been compliant. There was a lot less cars on the road yesterday afternoon and this morning. We know that some people will need to leave home for work and for essential purposes. Please make sure you are wearing your masks. Also, the one reason we absolutely want you leaving your home is if you have any symptoms. So please, if you have any symptoms, go get tested. We have clinics right across Queensland, but particularly, as the Premier said, we have 178 clinics, both public and private, in the Greater Brisbane area. They're open for extended hours. We still have our 24-hour clinic operating at 8 Mile Plains, and I thank the people who went to that. We had 1,347 tests at that clinic over the last 24 hours, and it will continue to operate 24 hours at the moment. And also, I thank the private providers who are opening up over this weekend as well, so that people have more options to go get tested. And again, jump on the COVID Queensland website to find your nearest clinic, what their operating hours are, and if it's a private clinic, whether you need a referral or not, so that you can go get tested. We hope that the weather doesn't deter people from doing that. It's better than standing in the hot sun, so go out, get tested. There is no long waiting lines at the moment. I will be getting regular updates. At least 3 times a day I'll be notified of what the wait times are at our clinics, and that won't be just Greater Brisbane. We'll be looking across Queensland whether there's any surges and whether we need to increase capacity or set up any additional clinics. It is really imperative at this time that people come out and get tested if they have any symptoms. So thank you to everyone for their cooperation. And the last thing I say is respect. Please, we saw very long lines in our supermarkets yesterday. Again, it is completely unnecessary to race out and load up on groceries. The supermarket stores are not closed. I know some people are concerned that this may go beyond 3 days. Irrespective, we have never shut our supermarkets. They are essential businesses that will always be open so that we can have people being able to go out and get essential items. For those who are lining up and hoarding food, can I say the only people who are going to suffer from this are our elderly people who will be getting anxious because they're worried they might not be able to get food items, who live from week to week, potentially our pensioners. So please, think of others. Do not go out. Do not buy more than what you need. It is a normal weekly shop. You don't need any additional items. And we ask that you show respect to other customers, to the retail staff, and of course, show respect to our frontline staff out there, all of our health workers who are doing such an important job out at clinics and our hospitals, to our police who are going to be out there checking compliance, to our ambulance officers, to all of our frontline staff. Please show respect. They're just trying to keep you safe, and we're trying to get through this as quickly as we possibly can. Any questions?
Can you clarify, there's a bit of confusion if people need to wear a mask in their car.
So our message is clear. Over the next 3 days, for when you leave your home, put a mask on. That way we avoid confusion as to whether we need it on this time or that time, whether we're walking alone or we're in a car alone. The fact is, the best practice possible is at the moment you leave your home, put your mask on and don't take it off again until you walk back into your household. This is the way that we will keep our community safe and to ensure that we are taking the strongest measures possible over these next 3 days. Thank you.
Please.
I might just put this back on. Thank you, Dr. Young.
Thank you. My team have just given me the details on that Jetstar flight. So it's JQ570. It arrived into Brisbane at 11 p.m. So it was the Melbourne to Brisbane flight JQ570 arriving into Brisbane 11 p.m. on the 5th of January. Thank you very much.
So good morning. If I could just bring to your attention some of the things that have occurred since the start of the lockdown yesterday at 6 p.m. And as the Health Minister indicated, unfortunately yesterday we saw panic buying and large queues at shopping centres, which resulted in police having to attend to those areas to deal with that. The message is really clear. There is plenty of supplies. You don't need to do that. Please be patient and respect each other, although I'm happy to say that since that occurred yesterday, things have certainly settled down. We've taken a very much a communication, compassion and compliance approach, so we are trying to get compliance from our community around what we need to do over these next 3 days. And if we do that right, hopefully that means it will only be those 3 days. So what we've done is seen police handing out masks rather than fines to date. So up until this morning, our police officers in the community have handed out 360 masks. And what's been really encouraging is that people are keen to wear them once they understand what's required of them. We've had very few instances where police have had to take action. And in fact, there's only been 4 infringements issued in the Brisbane area overnight related to this. And in 3 occasions, those persons were actually offered the masks, refused to wear them, offered again, and then were given directions because they shouldn't have been out and about as they were, and then failed to follow the directions. So police were left with no alternative but to take enforcement action, which they did. We've seen a significant reduction in our traffic. That's very encouraging. It is the weekend to stay home and do things at home with your family or friends, bearing in mind you can only have 2 visitors into your normal household. So please abide by those restrictions. Overwhelmingly, our community is trying to do the right thing as they have done through all of the COVID response, and we want you to keep that going. So thank you for doing that. We will continue to be out and about. It is a high visibility policing presence and communication. We have done intercepts on both the M1 north and south, and encouragingly there's been very few instances where we've had to turn people around and ask them to return home. But we'll be continuing to do that right through the next few days. So please make sure that you have the right reason to go out, and there are those 4 main reasons why people are able to leave their premises or leave their residences. Just to reinforce what the Health Minister said around masks, it's really simple. When you leave your principal place of residence, put your mask on and keep it on until you come home. You can't go wrong if you do that. Of course, if you need to eat or drink, you can take your mask off. But once you've completed doing that, please put it back on. And there are other exemptions around performing your work, and people need to understand how they would apply to them. Overall, as I said, we'll continue to do this. Our police operations are operating effectively across the area. We saw a very quiet night in our liquor licensing area, so thank you to all the licensed premises that have listened to the messaging and did what they needed to do last night. I'll finish off by saying please expect to be intercepted by police if you're not wearing masks or if you're not out and about as you should be, and please, if you are asked to wear that mask, please put it on. Thank you.
So 4 people were fined for not wearing a mask while in Brisbane?
So no, there was 4 breaches of various things. The 3 that I referred to were people that were not wearing masks. They were offered masks by police officers. They refused to wear them. They were then given directions to go home because they didn't have exemptions to be out, and they've been fined for failing to follow the direction, which is a $1,300 fine.
So can I clarify, they could have got a $200 fine for not wearing a mask, but instead...
We're not fining anyone for not wearing masks at the moment. We're giving them the option to wear a mask. We're providing them the masks. 360 people have got masks. If they don't do that, we then ask them to do that. It's actually a more serious offence because they're not following a direction. So we're trying to work with the community on this. So the message is, if the police officers are offering you a mask, you need to put it on.
And can I just clarify, it is $200 the fine for not wearing a mask. But
That's a piece of work that's still underway, so we're not taking action on that at the moment.
Okay. Is that because there's no police power for that? Is that right?
No, this is a processing that we have to go through when we create new offences to get everything in place. So what we're doing is, as we always do, is we're taking an education, communication approach, and our office has got 40,000 masks that they can hand out. So I think we've got plenty. What we need is our community to listen to the messaging, and if the police officers are engaged with you and saying you need to put this mask on, you really need to put the mask on, and they will give it to you. So it's a pretty good deal.
There was 3 breaches for masks. Was there another one?
There was another breach for a person moving in an area that they shouldn't have. So you have to have the 4 reasons for being out, so that was a breach of that.
Did they have a good excuse or not?
No, obviously not. They got fined. Thank you.
So just, if I can just reiterate to everyone to please continue to wear your mask if you're in that Greater Brisbane region, and we'll be updating Queensland again tomorrow at the same time, 9 o'clock. And I thank everyone once again for their patience and their cooperation. And please, everyone, stay strong and stay calm, and we'll get through this together.
Sorry, a quick question. Yesterday we saw a mass exodus to the Gold Coast,
Yes.
Sunshine Coast. Is there any concern for people who have escaped Brisbane and gone up there? Should those areas be on lockdown as well?
We're not concerned. What we're asking people to do is that if they have been in the Greater Brisbane area, to actually stay in their accommodation until Monday, and we're hoping that people do the right thing.
Is there any update about that investigation as to how this nurse contracted the virus?
No, but what I can confirm is that Health have an investigation underway, and that investigation is being assisted by police.
And just regarding the cricket, is there any concern that the 4th test would have to be moved to Sydney?
No, as I said yesterday and the day before, that discussions are still happening and they're still positive.
Premier, your reaction to those scenes in supermarkets yesterday, the panic buying, how did that make you feel?
Yeah, well, look, there's no reason to do that. I just ask for people to be calm and be patient. We are not going to run out of food. There is no need to panic buy, and as the Health Minister said, we have a lot of seniors in our community, and it's really important that they get the essential groceries that they need. There's a lot of people out there that don't have a lot of money and they live by week to week. We need to make sure that they get the essential food for themselves and also for their family. So please, everyone, just be patient and calm. And this weekend is a good weekend to stay at home with your family and to do some odd jobs around the house, or indulge in some watching of Netflix or whatever you desire to watch.
Is the government preparing for a longer lockdown period than just 3 days?
Look, we will assess that on the Monday, but so far so good, Jack. 0 cases overnight is very encouraging. So let's see what happens on Sunday. Let's see what happens on Monday. These are the crucial 3 days that we need. And like I said, the whole country is looking at what happens here in that Greater Brisbane region, because we know that this UK strain is incredibly contagious. This is the first time it's been out in the community. And it's not to say it's going to be the last. You know, this could happen in any other part of the country as well. So we want to make sure that we do everything right and that we act very quickly and very hard. And I do welcome the Prime Minister's comments when he absolutely supported the strong action that we took.
When you got the information this morning and heard that there were 0 cases, what was your personal reaction to that?
I'm very happy, of course. I mean, Queenslanders have done a great job, and I want to keep that record going. But we are dealing with something here we haven't had to deal with before. So we have to do everything we can in our power to make sure that we can stop that community transmission. And the fact that we have identified those 91 close contacts, that they're in they're all isolated at the moment, that is encouraging news. But what we do need to know is that if anyone out there has any symptoms in that Greater Brisbane area, please come forward and get tested. It is absolutely imperative.
I have a question for Dr. Young.
Yes, sure.
I'm just wondering, is there any evidence that this UK variant that has a faster transmission time, incubation period?
I don't believe so, but remember, this is still quite early. It's really only been circulating in the UK for a month or so it's early to be getting the information. At the moment, we know that there have been cases with the usual longer incubation period. We've seen that in Queensland. So at the moment, we're just managing with that usual 14-day incubation period.
What do people need to do if they were on that Jetstar flight that you mentioned?
Yeah, they should come forward and get tested and isolate until they get a negative result. Yeah.
Thank you, everyone. We'll see you tomorrow.